My name is Gabriella O'Day, and I am a sports medicine and shoulder surgeon here at the Hospital for Special Surgery. Sports medicine is, particularly orthopedic sports medicine, is the field of medicine that cares for primarily soft tissue injuries of the knees, shoulder, ankles, and hips, and involves addressing injuries that can take people out of their daily activities or as well as sports. Primarily injuries involving muscles, tendons, ligaments, and cartilage. I see patients both in Manhattan as well as the Brooklyn office. I have a specific passion for women's sports medicine, both as a woman but also for somebody who wants to provide equitable care for our patients. And what we do know is that women often feel more comfortable talking to another woman about personal issues such as their health. And woman to woman, this allows me the opportunity to discuss specific stressors that a patient may have that may affect either their outcomes or their decision to proceed with a surgery or proceed with conservative management. But I also am able to understand how to speak with somebody at their level and allow them to really open up with me about, concerns they may have moving forward with the plan, but also allow them a comfort level to ask questions that previously they may not have felt as comfortable talking about with previous physicians. I use computer navigation during my shoulder arthroplasty as a tool to help optimize the outcomes and optimize the implants that are placed for my patients. I'm still the one doing the surgery the entire time. The computer navigation just provides a screen that helps me get a 3D model of the shoulder at the same time that I'm performing the surgery. And also helps me provide an implant that is optimized for them based on their size, based on any angles that are necessary to provide the best functional outcomes. As a physician, when I see success in a patient, I feel personally proud of that patient, as I understand that this was a team effort. This was both what I was able to provide for them as a surgeon, but also their motivations coming to fruition to see a successful outcome. I also feel a sense of responsibility to make sure that we continue to see good outcomes in them in the long term. But ultimately, I feel proud that I was able to participate in their care and get them through a difficult time in their life.